Hello, how are you?
Hello, Dr. Nasar. How are you?
What's your name?
Angelo Violante.
Hi, Angelo. And we won't talk about your age. We're going to skip that question. But in any case, why don't you, this is for the audience, for the internet audience, because there are a lot of people interested in finding out how people do with hip replacement surgery. And you just had hip replacement surgery, and you volunteered so graciously to talk about it. And I really appreciate that, first of all.
Right.
So you'll be our first video testimonial for hip replacement.
Well, hip replacement.
Yes.
That's it. I have to truly say, Dr. Nasar, that I was very apprehensive about even going for the surgery because I've been holding it off for a number of years. For the last 6 months, I've been going really downhill. And when I first came to see you, because I know a lot of people who've come to advanced orthopedic surgeons, and they all highly recommended. And when I looked at you and I talked to you, you made me feel very comfortable because you exuded your own confidence and your positives about you, and that really helped me. Even though I went for a second opinion, I said I'm coming back over to here because I really felt really comfortable about you. And when I went into the operation room, the OR, I was so upbeat, I was so positive. My brother was there, my girlfriend was there, and they were just so very happy that I was the way my mind frame was going at the time. And I said to myself, because I'm kind of a jokester anyway, so I felt I wanted to make your staff and you feel as comfortable as possible, not come in like these cranky, whiny type of a person going in for surgery. And when I came out of the surgery, out of recovery, my brother, my girlfriend said that you came out beaming from ear to ear and saying that your brother and your boyfriend, he did fantastic, he's going to do great, and this and that. And I was waving to them and everything, and I went upstairs, and everything after that has been very positive. So I'm doing rehabbing right now. I had an in-house patient rehab.
Right, so how long ago was the surgery? It's about 12 days now, right?
No, actually it's, no, this Monday it'll be 2 weeks, so
right.
It's 12 days, you're right, 12 days, right.
Yeah.
You know, so,
and
I'm coming along pretty well, so to speak.
Let me take you back to the hospital, because I know people are interested in what it feels like, especially, after the surgery that evening and the next day, like what, first of all, pain. Everyone's always wants to know, am I going to be in a lot of pain? And how am I going to feel? So why don't you tell us your experience?
Well, my experience, to be honest with you, I really didn't feel any sort of excruciating type of a pain, other than discomfort of being in a hospital bed. I'm an extremely independent person, and this time here I just felt helpless. But I kept that upbeatness in me and that positive thought in me. But as far as any sort of like pain, not really. When I came out of there, and I have to admit I should have listened to you, but I should have went straight home. But that being said, probably maybe my physicalness or in conjunction with your expertise and how you handle the surgery, it's putting me right on the road to recovery. And everybody's telling me I'm doing really good on this.
So as far as the therapy and getting up and moving,
right.
That's one of our focuses with our
Yes.
program at the Joint Center.
Right.
Did you feel that, first of all, did you like the
Yes.
therapists
Yes.
and
Yes.
the staff there?
The staff there, I tell you, the staff there was remarkable. I mean, I have no problem whatsoever with the staff.
And how did you feel you came along as far as getting up and moving around? How did that go? Because that's one of the goals.
One of the goals, yeah. I mean, you really, I have to say, you really have to be tough and disciplined, because your old habits kick in, and your old habits are, I'm just going to get up and do what I got to do. But it's beaten into you, so to be reminded to you over and over again. Do not cross your legs, do not bend at the trunk, do not do this, and that's what I keep in mind. So, you just have to learn to adapt to it. And you had two years, the physical therapists, I forgot his name, John and Eugene. They were good. I was teasing them. But they came in and they didn't even listen to me. They said, "Get up, let's go. We'll take you downstairs."
They're great.
They're great. I have to say, and I like to commend those two along with your whole staff. So if they're part of your staff, I really.
They're part of the team. Absolutely, very important part. The nurses and everyone else. Let's. I don't want to go on too much longer, but I think let's touch upon the home discharge versus the rehab discharge. because this is a new part of our program where we found out that we can send people home safely and comfortably. And I know you ended up going to rehab, which is fine. I allow my patients the choice. I told you from the beginning,
Right.
you do whatever makes you feel comfortable. I'm going to try to get you as good as I can,
Right.
so that you could go home, but you can choose to do what you want. So what did you think? I guess in retrospect now, as far as home versus rehab.
Well, home versus rehab in my condition. Now, everybody else is different because I've spoken to at least 12 other people in the gym where I work out, and I work, and they all said the same thing. You cannot go home under these conditions. Suppose you want to take a shower. Suppose you move the wrong way and you fall. You're going to be in big trouble. And they suggested it. But in hindsight now, I should have listened to you, and that would have limited a lot of problems because I was not happy. I was not happy whatsoever. And I'm not going to mention the name, but in the rehab hospital that I went in, I really felt that I was fending for myself. They were just bringing the food. So this is stuff that it's nothing like home sweet home, especially if you have somebody. I didn't have anybody in the house.
Yeah, that's why you were most nervous, because you didn't have someone in the house.
If I had somebody in the house, I would have definitely followed your direction and gone straight home, because you're really a good guy, and I felt very confident with you. But in hindsight, I would have just went straight home. So I recommend anybody who, if they have anybody home, go straight home. After the surgery from Dr. Alan Nasar, you're on the road to recovery. So if you don't have to go anywhere else, don't go.
Right, as far as rehab.
feel.
Thank you so much. I think we'll end it here, but I really appreciate you taking the time out to talk to us.
Good.
Thanks.